high levels of vitamin D3 in our blood, is it dangerous? Is it life-threatening? Yes, it's right. High doses of vitamin D3, it's dangerous. It can be life-threatening, especially for our kidneys. And yes, it gives adverse effects to our heart also. But what I have seen in my practice is 90% of people are lacking in vitamin D3 or are on the lower side of the normal of vitamin D3. And many people, they are afraid of higher doses of vitamin D3. That's why they are taking vitamin D3 in very less quantity. My motto of making this video is to educate you about vitamin D3 so that you are not afraid of vitamin D3 and so that you can hold good level of vitamin D3 in your body. If you will be deficit in vitamin D3, you are going to have hair fall, you are going to have bad mood, you are going to have body aches. Sometimes one shoulder is paining, sometimes another one. Then the pain moves to your lower back, then to one knee, then to another knee. These things are going to happen. Even it can give adverse effects to your hormonal functions. Many females, they can't get pregnant just because of lack of vitamin D3. So this vitamin is so crucial. And it's very easy to maintain good level of vitamin D3 in our blood. Now let's talk about what is normal range of vitamin D3 and what is the dangerous range of vitamin D3. The normal range of vitamin D3 is said to be from 30 to 100. Some labs, they write 30 to 80, some write 30 to 70. So it differs from lab to lab. But in general, it's 30 to 100. Above 100, that's 120, 130. Yes, it's higher than the normal. But the dangerous dose, it is when it's above 150. And frankly speaking, I haven't seen a single person in my life who goes above the range of 150 because you have to have very high levels of vitamin D3 to go up to this higher level of vitamin D3. So what is the right dose of vitamin D3? See, first, try to get vitamin D3 from the sun. Just go in the morning sun, do some exercises. You will get vitamin D3. You can walk, you can run as you are comfortable, and you'll be getting vitamin D3. Do it for a month or two, and then have a check. Do a blood analysis and see how much your body is holding vitamin D3. If you are suffering from any kind of disease, your digestion is not good, or if you are on any kind of medications, then these things can hinder formation of vitamin D3 in your body through the sun. So see how much your body is able to make vitamin D3 by its own. If it's making above 52, 55, 60, very good. It's very good for you. Continue doing whatever you are doing. You are doing all good with vitamin D3. But if you are living in a climate where there is less sun or no sun, or because of your lifestyle, you are not able to go out in the sun, then you have to supplement vitamin D3. If you are brown skin like mine, you have to be in the sun at least for 50-60 minutes. But if you are white skin, then 20 to 30 minutes will be sufficient for you. If you have more darker skin than mine, then you will be needing more time to be in the sun. And it should be morning sun, that's the safer one. So this is the ideal way to get vitamin D3. But if after doing all this, you are not getting good amount of vitamin D3, then you have to supplement it. Now, what is the best dose of vitamin D3 to be supplemented? If you are too much scared of high doses of vitamin D3, you can start with 5,000 international units in a day. That's totally normal. Nothing bad is going to happen. Maximum people who will be taking vitamin D3 5,000 international units per day, they are going to get their levels between 35 to 45 if you will do the lab test. So you can start with this dose and then do a lab test. If the levels are 35, 30, 40, then you can easily double the dose and then see the results, how much your body is holding vitamin D3. And about doing analysis of vitamin D3, you have to have a gap of at least 7 to 10 days before giving a blood analysis of vitamin D3. It's not so that today I have eaten vitamin D3 and tomorrow I'm giving the blood test. No, it's not going to show you the right results. It will be better to have a gap of at least 7 to 10 days before doing a blood test. So you have to know right dose of vitamin D3 for you. See, vitamin D3, 5,000, 10,000, it sounds big, right? It's actually in IU, that's international units. If you will count it in mg, it's going to be very less, 25 mg, 50 mg. This is going to be the dose of vitamin D3 if you will count it in mg. It is said in IU, that's why it sounds like very big doses. 5,000, 10,000. Yes, I agree with people who say that higher doses are dangerous. Yes, but what is the higher dose? This is the question. So I've told you, if it's above 100, yes, you should cut down on the dose of vitamin D3, but it's going to happen very rarely. In many countries, you can get one capsule of 40,000 IU, 50,000 IU. If you are getting that capsule, you can use one capsule in a week. Always remember, it is a fat-soluble vitamin, so it should be taken with any kind of fat. Or if you are taking it with food, your food should be cooked with ghee or clarified butter or in oil, then it will be absorbed better. Or you can just take 1 teaspoon of any kind of oil. Just take your vitamin D3 capsule with this kind of oil. Then you'll be getting much better absorption of vitamin D3. It will be better if you'll take it with vitamin K2. The chances of absorption of vitamin D3 is going to be much better. And if you are having any of the symptoms of lacking of magnesium, it can be bad sleep, bad mood, then you can use magnesium at night and vitamin D3 in the morning, and you will get much better results of vitamin D3. But you should add magnesium only if you have symptoms of lacking of magnesium in your body. Otherwise, vitamin D3 with K2, or if you are eating lots of vegetables, then just using vitamin D3 will be helpful. In many of the countries in Southeast Asia, you will get 60,000 international units capsules. One capsule in a week is also more than sufficient. Now, how long we can take vitamin D3? You have to take vitamin D3 continuously. This also, I have seen people making mistake. They take vitamin D3 for 2-3 months, and when they see, okay, in blood analysis, vitamin D3 is good, then they stop taking vitamin D3. You have to understand, as I have said earlier, our body uses vitamin D3 in more than 300 chemical reactions. If you'll stop taking vitamin D3, within a few weeks, your vitamin D3 levels are going to go down. So don't do this mistake. Don't be scared of vitamin D3. You can take it for whole of your life also. But if you are working out in the sun, or if you are playing in the sun, or if you are walking in the sun, then on that day and few days after that day, you can skip taking vitamin D3. So don't be scared of vitamin D3, but try to know the exact or the best dose of vitamin D3 for yourself. I have tried to explain my best in this video. Thank you for watching this video up to this part, for your time and attention given to this video. See you in next video with a big smile. Up to the time, smile more, stay happy, stay healthy.